In a world where the importance of sleep and airway health for kids is gaining so much momentum, we're here to provide you with a clear pathway through the maze of information. Join us as we connect with experts, share real-life stories, and break down the complexities that surround this critical issue. From screening techniques to collaboration with our medical colleagues, we're here to empower you with actionable insights and a supportive community. Let's navigate the path together to healthier sleep, brighter futures, and happier families. This is ASAP Pathway. Hi, everybody. Welcome to another episode of ASAP Pathway. I'm your host today, Dr. Stacy Ochoa, and I just felt compelled, actually, to bring on my brother is one of my first guests. And you might ask, why are you interviewing your brother? And for me, it was kind of like, you know what? Having this conversation with him, it's kind of a lot of your stories. I think our family's story is similar to many families' stories. So I'd like to introduce my brother, Jason Becker, who goes by Jay.
And other names you've given me over the years.
And other names over the years that I've given you.
Hey, what up? What's going on? Congratulations on your new podcast.
Well, thanks. And thanks for helping me. I just was going to give you some cred because I wouldn't have the podcast if you didn't text me and keep saying, when are we going to do the podcast? When am I going to help you set up your podcast? So
Annoying little brother.
I do appreciate that.
See, I was building skills over the years as the annoying little brother.
Yes, many skills. So I wanted to get, we have a lot of family history.
Can you hear me? Let me interrupt you real quick. Let me just say, my name's Jay. I'm the brother. And I just want to real quick tell you how proud of you I am. Oh, what you got going on there? Did you just mute yourself? And
I did. I had a cough.
Anyway, I just want to tell you that I'm super proud of you. And you've been sending me all of these audio links. And if the dental thing doesn't work out, you've got a laser clear path in the audio world. You got a great speaking voice. I was listening to your jingle, your intro. I had to over and over again because
yes, you did.
I was looping it, and I'm like, I don't know that she knows that I'm listening to her over and over and over and over and over. I'm looping it, and I'm making these feathered adjustments, no different than you would do on your in your world, right? So I'm just I'm making all these adjustments to your audio, and like if she knew I was just sitting here with her voice piercing into ear holes over and over again, she would get
thanks. I will
keep it up. I would really like to come see you speak somewhere. I think you've got something coming up in Texas or something. I'd like to go with you.
Yeah, where am I going? I do have something in St. Louis. Then I have something in Arizona.
And maybe that's what it is.
And then I had something in Florida, but I have had a conflict. But so
wherever you go when it's warm.
Yeah.
Wherever it's warm when it's cold, or something like that.
It's funny because I feel like every family gathering we have, somebody brings up their airway to me or their sleep to me in our family, because everyone's got an issue. And I'm not exaggerating when I say everyone has some kind of issue with their sleep. So, it started with, and it probably goes back before Dad. We had grandparents that snored and were, not breathing well in their sleep. And then, about 6 going on 7 years ago, which is hard to believe, we lost Dad to, he had a lot going on, but he did pass in his sleep. And he didn't have his device. He was CPAP intolerant. And he didn't have his device in that night. And you had the awful delegation of sorts. You volunteered to call me when I was on a plane to let me know that Dad passed away before my plane took off, which has affected both of us. with planes, which we've overcome it, I believe. Getting on planes and being triggered and things like that. So we've overcome that. But it's been an obstacle for both of us. You have airway issues. Your kids, my kids. I don't know. What's your story? Like, what's your perspective on all of this?
The way you said it was like you were hitting on me.
Was
You,
it?
you leaned in, grabbed your chin, and said, "What's your story? Big hunk of something." See, all good things for editing. So, yeah, you covered a lot of ground, and from everybody bringing up dental airway things when you're around, which I think is complimentary, and I know it's probably annoying as well. I can assimilate to it, it being in the industry that I'm in the energy market, and when things aren't going well with someone's power or their battery or their electrical in their house or whatever. So I get those impromptu questions about electrical situations and subject matter. So it it is you've covered that all the way up to our dad dying and us having problems getting on planes. So my story is that, I guess if I had to say something, the most impactful thing would be that I never knew how important breathing during my sleep was. I never understood that. And it became very potent, how important it was to me when um, I went and had life was, I was struggling with anxiety, struggling with panic, a panic disorder, going to the doctor, what's going on? And my primary says, well, let's take a look at all these things. And, well, my sister says I should have my testosterone checked, and I should have this checked, and I should have my vitamin D levels checked, and I should get my iron checked, and I should can you just run a full panel on me, doc? Because my sister and my sissy, she's telling me I got to have everything checked. And so we got to the point of testosterone, and he's like, well, you're still getting it up, right? I mean, you still, it's still working, right? And I'm like, well, yeah. Look, at the time, I think I was 39. And I said, I'm 39. It's not like I'm 17 walking around knocking lamps off of tables everywhere I go, but it's does what it needs to do. And he's like, well, then you're fine. You're fine. I said, as awkward as it is, my sister's telling me I need to get my testosterone.
My sister wants me to.
My sister said. So I get my testosterone checked and levels come back. There's like, Jay, look, here's where women are with their production of testosterone. You're below that, right? So women produce testosterone, and you're not even keeping pace with a woman. And I'm like, oh my gosh, well, that explains a lot. So I go to you, not talking about my testosterone levels
Well,
at
you
all.
had your level checked by him, and it was
Right.
so low. Yeah.
That's what I'm saying. So it came back so low, but simultaneously I'm coming to you,
Yeah,
and
that's true.
like you're telling me, hey, you've got sleep apnea or whatever. Let me make you this device. And so at the time, devices and appliance, they weren't on the market. So you basically pulled my bottom jaw forward, locked it in place, and shoved. I would call it epoxy because I'm in the auto mechanic world, auto body world, whatever it was, some resin epoxy material in my mouth, and made me my own device, filled up my entire mouth. And so,
well, I had to do that because we were sending something back, and I didn't have anything to keep you forward. So that's why I did it. I made you a device that was FDA approved, but then it broke and you were panicking. And so I had to make you something temporarily.
This is pre that, though. You got to remember, this is pre that device. This is, I'm going to pull you forward so that you can breathe, period. It was just off the cuff, experimental. Let's see what this does. And so I slept, this thing was awkward, bulbous, you name it, in my mouth. And, but I fast forward me putting that appliance in every night for 3 months, 6 months, whatever it was. And then finally I succumbed to, fine, I need to get testosterone therapy. I need to get T therapy. Right. So I go to the testosterone institute, whatever it's called, and they take my blood and they call me and say, Mr. Becker, we can't put you on, we'd love to put you on a testosterone therapy process, but we can't. And I'm like, oh gosh, they're going to tell me I have cancer or, whatever. And I said, well, why not? And they said, well, your testosterone levels are actually higher than someone at your age actually should be producing. I mean, your stats are higher. I'm like, what are you talking about? And then I call you. I'm like, this doesn't make any sense. And you're like, well, are you using your appliance? And I said, yes. And you're like, well, then you're sleeping. You're sleeping. And you began at that point to tell me, and I have been an advocate to men anytime I get an opportunity to tell men about their testosterone production. And I don't go into it like clinically like you would. I just generally talk to them about how I talk to them in terms of like, look, your testosterone manufacturing plant, it kicks on when you sleep, and not just when you sleep, but at the end of your sleep, and not just at the end of your sleep, it's at the end of that end cycle. So there's stages of your sleep, and your testosterone kicks in and just starts flooding your system so that you get up and you're ready to do what needs to be done as a fella. So if you're never getting to that stage because you're choking while you sleep, you're never producing that testosterone. And that's why your testosterone likely is low. It's not every case. It's not all the time. You could have an issue, a medical issue that's preventing you from producing testosterone, right? Like there could be a for real issue. But my biggest thing that I try to tell people is, before you come at it with synthetic testosterone and pills and all these things that everybody wants to sell you to pharmaceutically get you to where you need to be with your testosterone level. And it's not just about erections and sex performance. It's about everything else in your life, the clarity,
well-being, overall well-being, and yeah.
The process of nutrition and processing your food correctly, and your growth hormone, everything as a fella is dependent upon the accurate and efficient production of your testosterone.
Well, and if you extrapolate that to kids, where, I mean, we have a society of children not even getting growth hormone, and growth hormone is only secreted in stage 3 sleep. So in a child, growth hormone, helps them grow. But in an adult, growth hormone is repairing and healing you. So you've got, adults wake up in pain. We've got this blanket, chronic fatigue syndrome, all these chronic pain issues. Well, if you're not, sleeping, you're not healing. And if, as a child, if you're not sleeping, you're struggling to grow. You're struggling to have all those hormones flooding your system that only occur in your sleep. And I mean, it's not uncommon at all for us to see kids that have failure to thrive, or they have all these, they're in the bottom percentile of height and weight, and, issues with ADD or ADHD. And it's just the first thing people need to be asking is, is your child sleeping well? So you experienced this definite line in the sand, like black and white. Oh my gosh, huge difference just from sleeping with one thing. Like you can even, like look at my testosterone, but there's so many other things. You mentioned panic and anxiety, and that goes with a lack of sleep, depression, anxiety. But I mean, you had panic issues started for you, and like,
yeah, as a kid. Yeah.
as a kid.
Yeah. And so I go back to like the discussion of, you said, having airway issues as a kid, as a young man, were it wasn't even talked about at the time. So my onset, I mean, I had such a crowded mouth. I mean, I just had, I mean, a mouth full of marbles. I mean,
Mm-hmm.
I look like Jaws. Uh, whatever, however the dice rolled for me genetically, I just didn't have a very large armature. That's,
Well, you also had horrible allergies as a kid. You weren't breathing well through your nose as a kid, which is what causes a lot of the onset of the growth and development problems that we see in kids. So something gets introduced that kicks you off of a path. Your trajectory should be going this way, and something inserts itself and changes the trajectory. And for you, looking back, actually for both of us, I mean, we both had allergies. We both, I mean, I remember my tonsils were so huge, the doctor kept telling my mom I needed to get them out, but I kept getting horrible infections to the point where they found out as an adult, when I had my tonsils removed in dental school, the ENT, after I woke up, he said, "When did you have a tonsillar abscess?" And I said, "I've never had a tonsillar abscess." He goes, "Oh, no, ma'am. You had a tonsillar abscess in your life. That usually takes people to the emergency room."
Oh, wow.
And I remember, because he said he saw the scar from it.
Mm.
And I remember being in middle school and mom saying, "I think I'm going to take you to the hospital." I mean, my fever was so high. I was in so much pain and I was hysterically crying because I didn't want my tonsils out. I was terrified. And I bet you that is when I had the abscess. Lord, I mean, looking back at that, she should have drug me out of the bed. More mom guilt for mom. But
You can have her.
I,
We'll both
uh,
have our own podcast.
we'll have mom on a podcast and why didn't you this? Make her feel worse than she already does. I mean, that's a real thing too, as a parent, is when you see this stuff
Well, you
and
go back and you didn't know.
you
So,
didn't know, we didn't know. And I didn't know when even my oldest was really little, it wasn't even a thing. So there's stuff I would have changed differently with my son, Ben. Like,
well, allow me please to piggyback on the parent guilt topic that you brought up. So, yeah, we can definitely have mom on our podcast and just make her feel bad for all the things she failed at as a mother. I would say we turned out okay.
we did.
So, um, what she didn't know was that, I mean, you hand your child over to a medical professional to help, right? And in her case, she handed us both over to an ortho that extracted, for you, I don't know how many, but for me was 8. So
Yeah, I had 8 teeth out if you
8,
count Wizzy's wisdom teeth too. I
yeah,
had 8 teeth with which again at the time
standard
the
practice,
standard practice,
right? So there's
instead of let's try to make room for the teeth for you and then ask a bigger question, because I mean the orthodontist didn't make our mouth small, it was small
that's
from other
that's,
problems.
that's
but
right.
and but what we're trying to,
Bad genes,
not, it isn't a bad genes. I mean, I think it's up, well,
bad
there's a
genes.
genetic aspect, but it's more like epigenetics, meaning okay, like within our family. But I mean, you look at mom and dad, neither of our parents had braces. Neither of our parents um, had crowded teeth.
That's my
Mom
point.
and dad look great.
Something genetically is,
It's no, it's the environment got inserted differently for us. I mean, you do see a difference in um, within the generations. Something was different. This is what we're trying to figure out, is why all of a sudden, I mean, crowded teeth existed in mom and dad's generation, but they definitely, there's some genetics at play, but also mom and dad don't struggle or didn't don't mom doesn't struggle with allergy issues like you and I. You and I are a mess. You more so than me.
yeah. I've gotten, luckily, I've gotten a lot better with allergy therapy stuff, and better diet is
And
huge.
that's the other key, diet.
I'm gonna go back to you. Yeah, that ortho didn't make our mouths small, but I would argue that he made my because I'm not in your mouth. He made my mouth smaller. I would argue that because just structurally, he removed all the things in my mouth, and it compressed, right? So like he, I all of that gapping that was there, it just, to me, logically would seem like things did get somewhat smaller.
Yeah, it didn't help. That's for sure. An already existing problem
right.
wasn't helped. Yeah.
Yeah, I feel like it's almost like if you had a bunch of items on a table and you wrapped a rubber band around them and said, "Hey, this rubber band is too many objects for this rubber band. It's too much stress." And then you moved items from the rubber band. The rubber band's going to continue to get smaller to a point, right, until it becomes relaxed. And I think that's like right now I'm speaking to you and I'm biting my tongue as I
Yeah.
say
I was just going to say.
and like my tongue touches, like it's my tongue is on the lingual side as I talk to you. It's not on the inside
You mean it's on the buckle?
side. What I'm trying to say is that my tongue right now is on the lingual side. When I'm talking to you, I have to really compress my tongue to get it to fit inside of my mouth, inside of my teeth. But normally when I'm talking to you, it's on the outside. It's on the buccal side as I say testosterone. My tongue is touching my cheeks as I say testosterone.
Yeah, it's funny because I was years ago, I was at some conference and a myofunctional therapist was there. So they specialize with a lot of times they help with speech and swallow and different sounds, and basically the function of the face and muscles of mastication and things like that. But she looked at me when I was talking and she said, well, first of all, it's like you start to see, once you learn this, you start to see certain faces and you can pretty much predict who's had too many teeth out and who's had
Yeah, I bet that you can probably see someone's facial structure and go,
yeah,
"Ooh,
and you go, oh, I can tell that's
my,
a situation where maybe they had some teeth removed because they quote unquote didn't have room for the teeth they were given. But
you know,
she said to me, oh, I can tell you're a bicuspid extraction case. And I said, oh, do tell, and then when she pointed out my facial structures, I actually had someone in a lecture at the front of the room point me out. I don't know why I get picked on in lectures. I've been picked on, but for how my face looks. And so I feel like Quasimodo, in the room. I feel like, the Elephant Man because they pick me out. But then she also said, you also lisp. You have a lisp when you talk, and so do you, because you don't have room for your tongue. So when we say S's, sometimes I have to be very intentional with my S's. But yeah,
very much so, very much so,
because we have no
but then
room for our tongue.
our kid can fit a fist in between their teeth. Like you got your oldest, who
Oh
can
yeah,
like 4 of his grown man hand fingers in his mouth,
in his
and
palate.
yeah, and I can't. My two thumbs.
Yeah, you barely fit a thumb in your palate.
Yeah, my two thumbs are the same. You took my two thumbs, and I don't have huge hands, but I have decent sized hands. And my two thumbs, the width of my knuckles is the same width as the outside of my teeth, the outside of my mouth.
Well, what's interesting is, and I say this when I lecture, I always try to bring up dad. I like to throw out a shout out to dad just because.
What up, Dad? Shout
What
out.
up, dad? Shout out to dad. Because if it wasn't for dad, I would not even be in this airway journey because he was CPAP intolerant, and these sleep physicians in St. Louis, Dr. Joe Ogile, who's one of the best, I mean, nationwide even, and we have him here in St. Louis. He was dad's sleep doc. And, I was fortunate to go into practice with a dentist that taught me airway and how to screen, but I wasn't intervening like myself. I wasn't making the device. I was intervening with referring, that's for sure, but not intervene, which matters. But I wasn't doing any devices or any therapy myself. Well, so this sleep physician comes to me and he's like, I don't understand. Your dad cannot wear this CPAP. He is struggling. Your dad is struggling. And I'm doing, we've done everything we can. We've changed masks, we've changed pressures, we've done BiPAP, we've done all the different things, and your dad just won't wear it. Why won't you make him a device? And I said, I just don't know how. And I'm very analytical. I'm an all or nothing. I'm analysis paralysis. If I can't do it perfectly, I won't do it at all. So, and he looked at me and he was like, sounds like you need to learn how to do it for your dad. And I was like, oh, wow. So I went to a course for dad.
You're the same way with this podcast. That's very much you. Analysis paralysis.
Yes.
And over, yeah. And I think
it's a lot of dentists too. That's just kind of, there's a weird culture. It's not just a culture. It's not how, there's definitely a way we're trained in school, but
there's a character set that comes along.
Yes, there is personality for sure for most dentists.
Yeah.
But I always like to do a shout out for dad. And, but I remember when I started, actually, when I was on the plane and you called me to tell me about dad, I was headed to a pediatric orthodontic intervention. It was like the fourth and final class. It was like our graduation. There was going to be a cool, fun ceremony party at the end. And it was like the final, course. I was really excited. It was going to cinch up a lot of open ends for me. I was really looking forward to it. But I remember having conversations a few weeks before that with dad. And I always talk about this in the course too, because it's so important with why ASAP pathway even exists, is dad was like, sis. Dad always calls me sis. That is a thing. I don't know if that is, I have friends on the West Coast who said their dad called him sis too. But I also have friends, because I'm like, is this a regional thing that men call their daughters sis? But I can't figure it out, but it definitely, I've met people all over the country that say, oh my gosh, my dad called me sis.
That's
but
sweet.
Others look at me when I say my dad called me sis, and they're like, why?
Oh, that's funny. Like, you're Missouri,
He's
or
not your sis. You're not his sister.
they're waiting for the banjo to play in the background.
Yeah, like, where are you from again? Is he your sister?
I'm the
Or
best.
so he always was like sis. But he said, sis,
I don't call you sis. Sometimes
you call me
very rarely, Aunt Sissy. Well, my kids call you Sissy anyway,
or sister. But anyway, he was like, why are you're leaving all the time? Because I was traveling constantly. Because I was just desperate for answers. It's like, there's this meme that I throw in my presentation a lot, and it says, a worried mother does better research than the FBI.
Oh, for sure.
That is for sure. And I'm not saying dads don't do this too, but
we're not the same.
It's just different. It's just
we do
different.
Between you and my wife, it's a gift, but the over obsessiveness about particular things, and to the extent of infinite research to try to find out why that bump is on their arm, or why, what is that?
It goes back to, we want our children to survive. It is our job that our children survive. It really is. So, it just changes as the generation. It just looks different with each generation, but the moms still, we're warriors for our kids. But, anyway, dad said, why are you always traveling so much? And I told him, and he said he struggled, even though dad didn't really have any crowded teeth issues and didn't have any arch development issues per se, but
yeah, big teeth.
He had beautiful teeth. Matter of fact, I have them immortalized. I've got mom and yours. So I think I have yours up on my shelf in my office. Oh no, I have Ben's. I just need to get the whole families up there. I have 3D printed models of dad's teeth and mom's teeth
inside of Ben's model.
Yours. We should do we should show how little your mouth is compared to my oldest, who I did a lot of orthodontic intervention and
Have to let
TAD
them.
expansion, and yours looks like a 5-year-old's. It really is the size of a 5-year-old. Mine is too. If you compare our upper arch to a 5-year-old, it's about the same size.
You were saying what Dad said.
Yeah, he said, what are you doing? And I said, Dad, the kids, they're not breathing well. I can't get any answers from, the docs, the pediatricians are like, you've done everything. I don't know what to say. And there were no answers. The ENT's done all they could do. And, Ben didn't have allergy issues. So, I just didn't know what to do to help him. And it just made sense. Like, why? I don't want him to have the same mouth I have, the same mouth you have. And I don't want Dad. I said, Dad, I just don't want my kids to have the same struggles you have. You open the fridge and there's your insulin sitting in the butter dish. That's your pancreas. I actually told the kids once I opened the fridge, I said, hey, you want to see where Papa's pancreas lives? And I showed them all his insulin in the butter dish section of the fridge. And they looked at me so confused. And I said, that was their first lesson in insulin and the importance of diet. But when you looked at Dad, it's, and apnea is such a beast of like, what is it? We see the collapse of the airway and we say, oh, that's sleep apnea, obstructive sleep apnea. When the airway collapses, you can't breathe. I tell people, if you were making a snoring sound while you were awake at work, if you were doing this at work, you would run to the emergency room.
I'm so grateful that you brought that up, because I use that example quite a bit when I travel quite a bit as well. And sometimes us fellas will share a room. Sometimes we won't. And I share a room with dudes that are choking. They choke overnight, and I let them know. I'm like, hey, did you realize and I don't say snoring.
Snore.
I don't use the word snore
It's
anymore.
too benign. The snoring is a benign word.
It's a cartoon. It's something old men do. They saw logs, like, oh, I was sawing logs last night, getting some good sleep, almost like it's a sign of good sleepers. Wow, I was snoring away last night.
Yeah, I slept so good. I was snoring.
Oh, wait, no, I don't. I said, hey, Mandy, I didn't know. Did you realize that, you realize you were choking? You were choking a lot last night. They're like, what are you talking about? I'm like, last night you just kept choking. You kept choking. They're like, and they don't know what I'm talking about. And I'm like, yeah, and I will make the sounds that a choker makes when they're choking. And I said, dude, if you were making, like, I'm really concerned. Like, if you were making those sounds during our meeting today, they'll laugh about it. Like, oh yeah, my wife says, I can't sleep. And again, you got secondhand sleep apnea. Your wife is suffering because she can't sleep. But I'm like, hey, if you were making those same sounds and you were doing that during our meeting yesterday or today, I would call an ambulance for you. I would presume something's wrong. Something's obstructing your breathing and you're going to die. There's a problem. You're not getting oxygen to your brain. That's a problem. And it's funny how dudes think. So that's why I'm on your podcast today, is because I get it. I get that your audience is because it's pediatrics and because kids can't wait. And I love the pun on the ASAP, and it's meaningful. But honored to be on your podcast, and I know that this podcast will likely be shared with other, like, moms are going to share it with their husbands, because they're going to say, oh, this dude was on this podcast talking about his testosterone levels, and he was talking about how men they look at it as an iconic trophy, that I don't need much sleep. That's how men are. Like, I don't need it.
It's almost a badge. Like, I can sleep. I function on 4 hours just fine. I'm like, no, you don't.
Oh, if you want to win, you go to bed. You crush it all day long, and then you
get a good 7. Yeah.
Get up good. No, like I only need 4 hours sleep, go to bed at midnight, get up at 4, hit the gym, da 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 da. I'm like, oh, but like a badge of honor would be that you went to sleep rested and produced testosterone on your own. That would, like, look at the testosterone I produced, and now my body's going to operate properly, and I'm not going to have all of these subsequent issues, systemic issues that come along with not sleeping. And it's not just testosterone. It's the lack of oxygen to your brain, and
Mm-hmm.
your brain going into survival mode. That's what's
It's
happening.
fragmenting all night. And your brain's job is to literally remember
You're alive.
R2D2.
It's to keep you alive.
It's to keep you alive. R2D2, remember he used to be in a backpack or whatever for Luke Skywalker.
No.
He would carry him around
Oh.
and he would scan. He was always scanning
Which one is R2D2?
the little round guy
Right.
with the little, and his head would be scanning.
Yeah.
And he was making sure Luke, his master, was okay. He's always scanning. Is my master okay? And that's what your brain does. It's always, is my human okay? Is my human okay? It is doing that all the time.
It's
And
crazy how it responds to keep you alive.
when its human is not okay, it sends signals and it startles you. And that's what the, thank God you take the gas, because that's the big old dump of cortisol to try to wake your body up so you will breathe and go past the obstruction. I actually had a patient last week. This is what I told my team, the importance of this. When you intervene and we have these discussions, and I know that sometimes having these discussions with your patients takes an extra 2 minutes. Do you snore? Has anyone told you you snore? Well, when you ask someone, do you snore? They're like, I don't know, I'm sleeping. So has anyone ever told you you snore? And we say this with even like children, they don't have to snore. It's even mouth breathing or heavy breathing. You shouldn't hear breathing. It should be very quiet. When babies are born, you're staring at them to make sure they're alive because you hear nothing. That's breathing. That's normal. You shouldn't hear breathing. It shouldn't be labored.
Fighting to do it. It's not fighting to breathe.
Yeah, it's not fighting. It's very beautifully passive and quiet. So, but, I had a patient who, and I was just saying to our team, how important it is. And it was weird. We were in a huddle last week, and one of the front desk treatment coordinators said, hey, do we have a patient named, Santa Claus, for HIPAA reasons, I can't say his name, but, and I was like, oh my gosh. Yeah, I think it was a new patient. He just came in 2 weeks ago, maybe. She said, yeah, I passed a funeral home and I saw the name. And I was like, oh my gosh, wasn't that the name of our new patient just a couple of weeks ago? So the other doc in our practice, Dr. Emily Mack, she went and looked up the obituaries, found him, looked in our database, and it was him. Same birthday, same age, same name. And I just had prepped a crown on him. And as soon as she said, he's our patient, he was 62 when he died. And I looked at the notes because he is in my head. I see a lot of patients. I'm like, why is this guy in my head so much though? And here's why. This is why he's in my head. I went to the notes, saw him as a new patient, and he had all these things in his health history: high blood pressure, high cholesterol, atrial fibrillation, AFib. And when I see those, even without the AFib, and then his teeth are just ground down to nothing,
Like mine.
I have the conversation of, hey, has anyone told you that you make sounds in your sleep? Do you ever wake yourself up choking, gasping, heart racing? And he goes, yeah. And I said, well, I just want you to know I specialize in dental sleep medicine. And so when I see these things, it is my obligation to have a discussion with you that I'm concerned that there's something underlying, and I can still see this guy's face underlying going on. And I can see the blank stare that we get as dentists when people are like, why wouldn't my medical doctor have brought this up? Why is my dentist bringing this up? What are you trying to sell me?
That's exactly
Wait, where are we going? Come on. What are you trying to sell me?
Copay. Okay. All right.
Yeah, okay. And he's like giving me the blank stare. And I said, look, especially with the fact that you have AFib, there's a huge connection. And I highly encourage you in our job as which we're trying to potentially look at changing the name of a general dentist to primary care dentist, because that's really what we are. We're the primary care oral health physicians. But, you know, I said there's such a connection between airway health and AFib. There's a huge connection. You can do your own research. I try to just plant seeds. Some people are so appreciative that you bring it up, and other people are hesitant. And that's okay. They're not always ready to hear it. So I said, he goes, can you just make me a guard to protect my teeth? And I said, well, that's like me putting a helmet on your head and saying, okay, go ahead and go back to banging your head against the wall. But I gave you a helmet.
That's a good analogy.
I would rather you not bang your head against the wall. That's what I'm here for. So I would like to find out the why behind you doing this, and not just giving you some plastic to protect your teeth. You may just need plastic, but let's do a study. He comes back a few days later. He needed a crown prep. And I said, okay, so when we seat this crown, he goes, yeah, I want you to make that guard to protect my teeth. I said, I will not make that guard without a study first. It's my obligation. I know too much. I can't do that. I need you to have the study. And he goes, well, I went and bought one over the counter to protect my teeth anyway. So after you said, showed me how bad my teeth are. So I bought an over the counter guard to protect my teeth. And I looked at him and I said, again, I really want to get to the why behind your grinding. And he looked at me and he said, you know what? I'm just going to roll the dice on this one, and I'm going to take my chances.
Yeah.
And he died 9 days later. I don't know the cause of death, but I'll tell you, his health history did not have any underlying. He had AFib, so his risk of stroke is extremely high with AFib. But if you have AFib and you are an unresolved apneic, your risk of stroke is insane. So it's highly likely that that's what happened. But he also, it's just sad, and it really hit the team, because they're like, oh my gosh, we remember this guy in the discussion and the pushback. And he took his chances and it didn't work out. And the average age for someone, based on most research I have seen, that has unresolved or uncontrolled obstructive sleep apnea is about 64. And Dad was 3 days away from his 64th birthday. And this guy was 62. And I try to tell people, look, I'm just wanting you to be here a whole lot longer for your family. And so I can see your face twice a year. So, I'm just planting seeds. But I know we got to go in a minute, but what were you going to say?
I don't. I'm going to leave here and go to the store and get things to work on my speaking of 62, my 1962 Volkswagen.
Oh, that's fun.
So I hear that from guys about grinding their teeth, and they'll say, well, I tell them about my appliance that my dentist made, and they're like, oh, well, I've heard about something like that, and can I just get something like that over the counter? And I said, I don't recommend that. I'm not a doctor. I'm not a professional in the world of oral healthcare. But let me caution you that if you go and you go get something that's over the counter, or you go get something to help you with, because in my conversations with these guys, we'll talk about the grinding of my teeth. And so I have, as I have cow teeth, which was, one of the side effects of all of my apnea issues. And I warn them carefully, saying, look, if you go and you get one of these over the counter things, you're going to customize an appliance to fit your mouth in the wrong position. And likely it's the position you're choking in. So right? Typically these things, you go and you heat them up, you put them in your mouth, you bite down, you clench, right? And it's to lock you in
Well, a
place.
lot of them, they're called boil and bites, and they do bring people forward. They
Yeah.
do. And people will say, "Oh, it helped my snoring. My snoring went away." And I always caution patients. I have patients that did the boil and bite from Walgreens and CVS, and now they can't get their jaw back in place at all. And so, I mean, within like weeks, their jaws are kind of locked forward and they can't get them back. I can't get their jaw back, but because someone didn't properly, manage this. I wouldn't recommend going to Walgreens and helping yourself with your airway any more than I'd recommend someone going online and buying blood pressure medication for themselves or insulin for themselves and trying to manage that either.
I guess
So
that's my. You've got these guys like that fella in Santa Claus who said, I'm going to roll the dice and go do my over the. I caution against that, because you don't know, like, are you buying the right device, right? Like, are you buying an apnea device? Are you buying a teeth grinding thing? And then you wind up locking yourself in place. And then that's the problem that you have. You lock yourself in place to choke. And so you're not able to grind yourself into a position to breathe again, or you choke and you die, whatever. So those scare me.
yeah, well, they scare us too. They scare us. When I say us, dental professionals that manage obstructive sleep apnea. I mean, it's very scary. These over the counter. I'm like, how can that even be approved and allowed to happen to manage your own? I just don't understand it. I got to wrap up here, but I wanted to ask, you know what? It's so funny too. I'm thinking of all the things I've said where I started to prove, like give a point or a statement, and then I just go off to somewhere else. But this is what happens with two people with ADHD have a podcast with each other. I don't know how many things I started to say and didn't finish, but
job of keeping you on track.
yeah, sure. So I wanted to wrap up. I have three very important questions to ask you.
Oh,
Since we are talking about kids, and then I do have to dart because I have something very important to do, like a facial after this.
Three very important questions that you are 7 minutes late to asking me.
I know. I got to go. Well, I'm going to ask really quick. So these are going to be rapid fire. One, let's talk about, what was your favorite cereal as a kid?
Ooh, Golden Grams.
Soggy or crunchy?
Soggy.
Yes.
And the Golden Grams milk at the end reminds me of the like when you go to an authentic Mexican restaurant, that cinnamon milk. I don't know what it's called, but
It's that white. It's so good.
Yep,
Cinnamon.
love it.
Yeah. Okay. Second, what was your favorite movie as a kid?
Top Gun.
Top Gun.
Top
And
Gun.
what was your favorite game to play as a kid?
Oh, Hungry Hungry Hippo with my sister.
Oh, that's a good answer. And I always won. Okay, thanks everybody for joining us today. And we look forward to seeing you again soon.
See ya.
To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice to replace your healthcare provider's diagnosis or recommendations.